My name's Fortino Gonzalez. I've been a therapist for over 30 years now. And my story it's very similar to a lot of other people that have gotten into MDT or McKenzie. It was just sheer frustration in my skills or my skill set and scrambling around to come up with a system, to be able to treat people and help people beyond just the guesswork, right? And it's very similar to Scott Herbawi's, where I was sitting in the PT office one day and I looked up and I see this manual for a Part A McKenzie course. Mm-hmm. So I took it and I started reading through it, and pretty much it was an aha moment, and read it maybe 10 times, ordered the textbook, read it 10 times, and then decided to take a McKenzie Part A. And by that point, I was pretty much all in because the system made sense. It was organized. It allowed me to immediately on Monday with that first patient to come up with a categorization and just, figure out what should I be doing with that person. And so it was very nicely packaged, and it made sense to me, much more than anything else I had done for that prior to that. Once I got into it and went through the credentialing process, I still wanted more. I just felt that there was more people that I could help. And that was a natural progression to applying to the diploma program, the residency program, and went through that process. And on some days felt that I bargained for more than I really wanted, because it was challenging to go into that type of environment with Scott Herbawi and Mark Miller and be there for 9 weeks getting pounded and retrained. But at the end of it, it was well worth it. And so that was kind of my McKenzie journey. From treating the patient and getting them through the process standpoint, it hadn't really affected much. Obviously, a percentage of people dropped off the schedule, and that was fine and dandy, because the majority of those were already on their way out. They were doing well. We were monitoring their outcome. The patients that come in, some of them were very nervous and scared about the whole process. Anyone that knows me knows that I'm the original monk of physical therapy. I'm already a germaphobe. So the clean procedure and the washing of hands and the sanitizing, that's a very normal thing for us. The creating the social distance and creating the procedure and the policy for what had to happen when the person came in was a bit new for patients. So, but they caught on quickly. They understood it. The other thing I felt that we as medical providers and practitioners our role in this whole situation was educating them and leading them to sources that were credible, so that they understood what was really going on, because you're dealing with a mass of people and a lot of information is flowing. A lot of us have been dealing with a lot of information coming at us, and some of these patients weren't quite sure what to believe and what not to believe, right? So I think being that kind of solid pillar in the community and making sure the patient understood, this is what's going on, this is the information you need to tap into, and some of those things you talked to me about may not be true or aren't true. So educating the patient beyond just what we're doing as a McKenzie practitioner, but the overall safety of their health and what they should be doing to ensure that. I don't know a single McKenzie practitioner colleague friend of mine that hasn't already assessed or treated someone over the phone, whether it be a friend or family member in a different part of the country. So it's very natural for someone to call me and say, hey, Fortino, I'm in, Washington. We went to high school together, whatever the scenario is, and I'm dealing with this situation. Can you show me some exercises to do? And I said, well, I can't show you exercises to do or tell you where to go for that, but why don't I have you move around a little bit? So over the phone, having them do, in essence, assess the baselines, repeated movement examination, figuring out, well, what category do they fit into? It's just a natural thing. And now with the advent of technology, and I still keep saying Skype, but it's, most people are using Zoom. The vast majority of people can be treated that way with hands off. Some people do need some hands off and forced progressions or forced regressions. For those people, for them to come in, in the safe environment and get them over the hump and get them back, to their home becomes very natural and normal. So without a doubt, I think the MDT model completely fits into what we're going through right now. And it's a glimpse into the future. It's a glimpse into what lays it, in our future. It's back to routines. Most of us tend to be very routine oriented. My wife's an educator, so she's doing a lot of stuff online with her high schoolers, and I've just tried to keep the same schedule. I'm not seeing patients every day of the week. There's 3 days of the week that I'm seeing patients, but on the days that I don't see patients, I still come into the office, and there's a lot of sharpening of the knife that has to happen, and polishing of the knife. But it's getting into a new norm. You find that you may have a difficult time falling asleep at night because you're not expending as much energy, because you're not running around the clinic trying to keep up with everyone and making sure they get what they need. So trying to find a way to expend that physical energy so that you stay on your pattern. Initially, I started starting my day a little bit later and waking up just a little bit later. And then I said, no, that's not going to work for me. I need to get back to my normal pattern. So I leave the house at the same time I always leave the house. I come to the office, I do what I need to do. And if I'm not seeing patients, I attack the gym. I actually do some work with some of the equipment we have, which is highly unusual for me, but it has really helped me expend that energy and get myself on a normal pattern. The McKenzie Institute USA has done a wonderful job. They've made it so easy for us to tap into some of the resources if you go to their website. Back in the old days, as I like to say, it was not unusual for me to pull out the original McKenzie textbook and read it over again just because, or read the newer McKenzie books and refresh my memory on some of the research and some of the numbers and staying sharp with it. Now I just click a few buttons, click, and I got a podcast, I got a webinar, I got an informational video on technique or marketing, or so it's just very easy to tap into that, and that has allowed me to utilize that and show my patients some techniques maybe, and give them that visual. So by far, that's a resource I use, and again, it's that old saying of sharpening the knife and keeping it polished, because you just have to keep on learning and refreshing your memory and staying on top of how do I best take care of that patient, and the resources are there. So it's been fabulous. You often hear people say, well, I took part A and I took part B, and I think I know what I need to know, so I don't know that I need to become credentialed. I don't know that I need to take part D, C, D, or E, or go on with it. And I would say stay the course, because there's so much to learn. I went back and I was looking at some of my courses and certificates, and I've taken over 40 McKenzie courses over the years. I mean, of course, some of those were required, but it's not unusual for me to go back and go, wait a minute, I'm going to take that class again, because every time I go back and take a course, I learn something, or I'm reminded of something. And this time that we're going through, where everyone is somewhat scrambling to keep themselves busy and trying to find a way to access the patient and make sure that the patient gets what they need, I say become really good at something and commit yourself to it. Continue to train. Use the resources available to you, which are right in front of you. And if you do that, then they'll come looking for you when it's all said and done, and you will be as busy as you want to be. So focus on the patient in front of you. Do that by becoming good at something, and continue to take these courses and pursue the credentialing, pursue the diploma, pursue the fellowship, pursue it, because it will make a difference when it's all said and done. They're just not letters you're accumulating. It's information, knowledge, and tapping into some fabulous mechanical minds that teach for the Institute that you have access to. And every day I'm reminded of that.